Hi, this is Dr. Pritchett with Professional Pharmacy Services, and today we are going to start our top 200 medication series. And we're going to cover cardiology initially and move on to other body systems. The drug group that we're discussing today are called ACE inhibitors. ACE inhibitors are used to treat high blood pressure, also known as hypertension. They work by preventing the formation of a chemical called angiotensin 2. Angiotensin 2 works by narrowing the blood vessels, therefore causing a rise in blood pressure. So, if this is blocked by the ACE inhibitor, the blood vessels will widen and cause the blood pressure to decrease. Common drug interactions with ACE inhibitors are NSAIDs, and those are your ibuprofens, your Motrins, which is also the brand name for ibuprofen, naproxen, Mobic, etc. Diabetes medications, other blood pressure medications, and this is very important because when you're on more than one blood pressure medication, you can cause a decrease, an abnormal, sometimes decrease in your blood pressure. So you always want to make sure that it's monitored. And also alcohol. Alcohol sometimes has blood pressure increasing effects, and sometimes it has blood pressure decreasing effects as well. Common side effects of ACE inhibitors are dry cough. So if you're experiencing a cough that is not producing mucus or sputum, it's just a dry hacking cough, and you know you just started an ACE inhibitor, that may be the culprit. You want to consult your physician to see if you can get this medication switched to another medication that may work better for you. Increased potassium levels, loss of appetite, and upset stomach. And one of the biggest and most dangerous side effects of this medication is angioedema. And that is going to be swelling of the mouth area, the throat area. Sometimes it'll cause a closure of the throat. So it's considered a medical emergency. So anytime this happens, a patient needs to make sure that they're going to the ER to get that checked out, and the ACE inhibitor has to be stopped immediately. So, what is a good way to learn these medications? These are not all the ACE inhibitors, by the way. There are many, many more, but these are the ACE inhibitors that are commonly prescribed. They're part of the top 200 medications, and I call them the Prils. So you have Benazepril, whose trade name is Lotensin. You have Enalapril, whose brand name is Vasotec. You have Lisinopril, whose brand name is either Zestrel or Prenavil. You have Ramapril, whose brand name is Altace. Okay, but just remember when you're taking an exam, especially the EXCEPT or the PTCB, and they ask you to identify which medication is an ACE inhibitor. Remember that ACE inhibitors are the Prils. The ACE inhibitors are the Prils. The ACE inhibitors are the Prils. Okay? And make sure you're learning that trade name as well. So that's it for ACE inhibitors. We will be releasing more cardiology medications. And when we're done with that, we're going to touch on all the other body systems. We are professional pharmacy services. We provide pharmacy education for adults as well as high school seniors. We also offer tutoring services for pharmacy technicians, pharmacy students, and pharmacists. Visit us at www.professionalpharmacyservices.com, on Facebook at Professional Pharmacy Services LLC, TikTok PPSEEE25, or Instagram PPSEEE. Have a good day, y'all.